Hey man, you're bleeding everywhere. What the heck happened?
I got stabbed.
Oh shoot.
It kind
You're
of
out.
hurts.
It hurts? Alright, I'm calling 911.
I got him in the neck though.
Alright, good job, man. 911. My buddy
Jugular.
got
Jugular vein.
my buddy got stabbed in his lower
dark-
right shin, and he
dark
also stabbed
red
someone,
blood.
but it's just him by himself right now. Yeah, we're at Alert Medical Training. Hey man, they're gonna be here soon. Good job.
Unit 707 dispatching you to a stab victim at Alert Medical. PD's on their way.
Alright, we arrived on scene. PPE is on. Scene safety is good. PD was able to retrieve the knife. Everything should be good by the time we get there. Number of patients 1. Additional resources is going to be fire and ALS, and C-spine shouldn't be needed. Alright, we're going to go ahead and start primary assessment. We see that there is bleeding. The general impression of the patient seems to be leading to core. I'm going to apply pressure onto the wound. I see that it's spurting, and it's spurting bright red blood, so it's showing signs of an arterial bleeding. We're going to go ahead and have the tourniquet proximal to the wound. My partner is applying the tourniquet right now. He is about to twist it, and we twist until the bleeding stops or if there's no pulse in the extremity. And then once we fully do that, we're going to go ahead and strap the time slip and write the time that we applied the tourniquet. We're going to go ahead and go to the next step. Hello, sir. I have a few questions for you. Do you know what your name is? Are you able to know where we're at right now? Okay, and you know what year it is?
2026.
Alright, my patient seems to be, oh, you know what time it is?
No.
Okay, well, our patient seems to be alert and oriented, times 4, and then I'm gonna go ahead and move on to airway. My patient was just speaking to me, so I believe the airway is patent. And then now we're gonna go ahead and go to breathing. His chest is equal rise and fall on both sides, bilateral. The rate and depth seems to be just fine. It's slightly tachypnea. So I'm gonna go ahead and put a non-rebreather, 15 liters per minute due to the blood site or the wound site bleeding a good amount. So I'm gonna go ahead and try to treat for shock right away. So my partner's gonna go ahead and grab the non-rebreather and apply it with the oxygen. While my partner is getting that, I'm gonna go ahead and check the patient's circulatory system. Check both bilateral radial pulses. They seem to be there, slightly weak, and then his skin signs is pale, cool, and diaphoretic. I'm gonna go ahead and grab a blanket also to treat the patient for shock and help him with his thermal regulation. And then we're gonna go ahead and try our best to mount the patient once everything's set to a gurney and transport ASAP to the nearest trauma center. Okay, before putting the patient onto the gurney, I'm gonna go ahead and do a rapid exam with 90 seconds. My partner's gonna talk to the patient to make sure that he doesn't lose consciousness in the process. I'm gonna go ahead and check his head, his face, his neck, and then after that, I'm gonna go move down to his extremities, his upper extremities, his chest, his abdomen, close, open the book for the pelvic injuries to make sure that there's none. And then I'm gonna go ahead and double check with the lower extremities, and everything seems to be fine, nothing out of place. The bleeding still seems to be stopped. So yeah, we're gonna go ahead and put him on the gurney and then transport him to the nearest trauma center.
Right now, I'm gonna start off with the history. Signs and symptoms. My patient is pale, cool, diaphoretic. He is in shock, but we have treated for that. Do you have any allergies, sir?
No.
No allergies. Do you take any medications? Okay. Provocations, like, does it hurt when you move your leg a little bit?
Not really.
Not really. What are the events leading up to this? Like, how did this happen?
I just got stabbed.
You just got stabbed? Why did he stab you?
I was just a homeless guy.
Homeless guy? Alright, just did that little rapid exam to do my DCAT, BTLS. We're gonna switch over to the vitals now. I'm gonna check his heart rate. Okay. Heart rate is 112. I'm gonna take your blood pressure. blood pressure is 108/76. Respiratory rate 24, O2 98. I'm gonna reassess every 5 minutes. I'm gonna make sure that I reassess the tourniquet, make sure there's no bleeding. I'm going to transport to the nearest Trauma 1 center.
Patient is most likely experiencing a hypovolemic shock due to his penetrating trauma with a knife laceration, creating an open wound, which significantly lost a huge amount of blood. So his heart rate was elevating due to the fact that it's trying to compensate for the lowered cardiac output. So since the cardiac output consists of stroke volume times heart rate, and since the volume goes down and the heartbeat has to go up to compensate for it, and this is why this patient is experiencing tachycardia. And
Hey man, what happened to your tip?
What?
Uday, bro, you're bleeding everywhere.
Bro!